The beauty of this kind of screening is that the light is so foolproof that either doctor or hygienist can use it. You look through the lens, any kind of inflammation or tissue abnormalities are going to present as dark. And if something is a temporary trauma, you simply push on it. You can push out that inflammation. If you can push out the inflammation, it's temporary, no harm, no foul. If it's something that is potentially cancerous, you're not going to be able to push that darkness out. So that initial screening can be done by doctor or hygienist. It takes less than 2 minutes and emits no radiation. The feedback I'm getting from the offices that we work with is that almost everyone says, yeah, let's do it. And they're glad that the office is offering that kind of technology.